everyone. As we all know that India is seeing a surge in viral infections due to H3N2 influenza virus. Now today, to discuss this, we have Dr. Dinesh Kumar Chirla, Director for Intensive Care Services for both Pediatrics and Neonatology at Rainbow Children's Hospital. A little bit about him. Dr. Dinesh has decades of experience in the healthcare industry and is on the specialist register in neonatology at the Specialist Training Authority of the Medical Royal Colleges, London. In fact, he is also elected as a Fellow of National Neonatology Forum and has several awards and achievements to his credit. Dr. Dinesh, it is an honor to have you here on the show. Before further delay, let's begin with our discussion. Dr. Dinesh, what is the H3N2 influenza virus and how does it differ from other strains of the flu?
See, flu is like a seasonal viral infection which primarily affects the respiratory tract. And if you see the influenza, you have influenza A, B, C. D is there, but D doesn't affect the human beings. They are primarily typed based on the two antigens H and N, which are primarily there in influenza A. And as most of us are two viruses in influenza, which we commonly, one is H1N1, which we commonly say as the swine flu. And second is the influenza B, which is the other type of flu virus which goes on, which has sort of the Victoria, which is also nowadays, which we are seeing in the community. The primary symptoms are there mainly in the respiratory tract. Some of them can have mainly upper respiratory tract infection like fever. Most of them have fever, but cold, cough. But some of them can have severe symptoms like pneumonia. Some of them have additional symptoms like vomitings and loose motions.
Can you tell us about the symptoms of H3N2 flu and how is it diagnosed?
The way H3N2 differs from H1N1 is sometimes, most of the time, there could be mild symptoms and children can get away. But the way it spreads could be quite rapid also. And that is how. But many of these viruses, the severity of illnesses varies based on the way the virus mutates. In some year, it could be sort of quite severe, and sometimes it can come out as a mild illness.
What are the risk factors for developing severe illness from H3N2 flu?
The risk factors generally for influenza are children specifically less than 5 years, adults more than 65 years, and pregnant women. These are the ones who get generally sort of, if they get pregnant, if they get sort of infected, pregnant women and other, they probably get a severe type. And that is the reason why vaccination to them is suggested highly. But even the other group, when specifically if they have support asthma, chronic lung infection, severe diabetes, severe heart problems, or severe renal problems, post-transplant people, these are also the high-risk groups. If they get an influenza, they can get a severe illnesses. That's the reason why generally it has been suggested children or adults with chronic respiratory illnesses, they are the ones who are supposed to sort of take this vaccination to reduce the severity of the illnesses.
How effective are flu vaccines against the H3N2 strain?
It helps in sort of preventing the two strains of influenza A, both H1N1 and H3N2, and also the two strains of influenza B. But what happens is the reason every year you get a new vaccine, and that's why it's called a seasonal vaccine, because the virus mutates and every time sort of, it either drifts or it comes into sort of something, a major change in it of antigen. So if suppose there's a major change in antigen, this vaccine stops being that effective as it has been designed. So that is the reason the vaccine efficacy can vary from 45 to 60%. But definitely it is known to reduce the severity of the illnesses, number one. It might reduce the need for admissions. That is second. It reduces the sort of fever and other things in this type of patients. So that is the reason it is highly recommended that you should take vaccination specifically for this high-risk group.
Can you tell us about the current treatments available for H3N2 flu and how effective are they?
Most of these viruses spread through the droplets. When you cough, you sneeze, and other things, or through the fomites when you come across and touch things which sort of they get in contact. So I think avoiding crowded places, wearing masks when you are coming in contact with someone who's got sort of infections. People who have symptoms trying to avoid going to the places which have their washing hands, something which has been very much aggressively promoted during the COVID time, still remain the standard of precautions for all these viral illnesses. If you generally see this year, apart from H3N2, the other viruses which has been dominant, which also has created major problems, is the adenovirus. Apart from influenza, there has been adenovirus, where children are having very high-grade fevers and respiratory illnesses, big adenoids and tonsils. So most of them have a very common sort of precautions of washing hands regularly, wearing mask, avoiding crowded places. This is the way we can sort of prevent the spread of these infections.
How is H3N2 flu transmitted from person to person?
During COVID time, most of the children were inside the house, locked down, and they didn't get exposed to most of the viruses. So after that, when they started coming into the community, they didn't have any immunity against most of these viruses. And suddenly that is the reason why when they got exposed to this viruses, they just spurt of this infection. The theory about that those who had COVID, their immunity has come down has not been proven. And I think there is no scientific basis for this. I think suddenly during the lockdown, most of these children didn't get exposed to these viruses. And that's the reason when they're getting exposed to, most of them are getting symptomatic. Eventually, children do get immunity, and we probably see sort of, children sort of normalizing after that.
Are there any strategies for preventing this flu in the community?
A lot of times, for majority of the viral illnesses, if they are mild ones, we have a symptomatic treatment. So we basically support them, hydrate them well, treat the fever, give symptomatic treatment for cold and cough. But some of them sort of either prolonged illnesses, or those who have sort of risk factors, or those who require hospitalizations, we have antiviral medications available. At this stage, one which is freely available is oseltamivir, which is there, which sort of is very effective against the viruses. So it has an oral preparation which is available. So which is what is given. Some people would give because when there is an epidemic going on, people will give empirically, or you do you say swab test done, like most of us are not comfortable about the swab test for diagnosis, and start them on oseltamivir. And majority of patients do respond to that. There are some now inhalation preparation of some of the antiviral medications, and oral, or IV preparations are also available. And these are known to sort of reduce the severity of the symptoms of pneumonias or any systemic infections with the virus, H3N2 virus. Also, any type of influenza virus. And also, a lot of this time, these viruses have secondary bacterial infections. And that is what we identify if they have secondary bacterial infections. But we strongly suggest that don't give empirical antibiotics unless you identify a secondary bacterial infection. One of the biggest problems our country faces is antibiotic resistance. So not all fevers are because of bacteria. So if you identify it's viral and there's no secondary bacterial infection, there's probably no need for antibiotics. So stick to the antiviral. Many parents ask, should I stop sending my child to school? Should I do this? But we have to continue, isn't it? The child has to learn, child has to grow up. So we have to take a general well-being of the child is important, which is by good nutrition, vaccination, taking healthy precautions like washing hands, wearing masks in the crowded places. These are something which we and especially if they're infected, stop sending them to school because you have to take care of other children also, is what sort of the message I have to give to all the parents.
Thank you, Dr. Dinesh, for taking the time out of your busy schedule and enlightening our audience with such an informative session. Thank you so much, viewers, for watching this show. If you want more, like and subscribe to our channel.